Lockdown lies. That's the topic of today's discussion on Bold and Blunt. And I'm your host, Cheryl Chumley, giving you a Christian conservative look at today's news, politics, culture, and events. And before we get into the lockdown lies, before we get into all the deceptions and skewed science that's being tossed about dealing with this coronavirus and how American citizens are supposed to respond to the coronavirus dangers, some of which are actually very real, I want to give a quick mention to edify.app/podcast. Edify is the platform where you can find the best faith-based podcasts in the nation. And guess what? Bold and Blunt is part of the lineup there. So check out Bold and Blunt at Edify and subscribe to Bold and Blunt at WashingtonTimes.com or wherever podcasts are offered. If you go to WashingtonTimes.com, though, to subscribe, just scroll to the bottom of the front page and find the newsletter section and click on my name. There you can sign up for my 3 times a week newsletter, which contains all my commentaries that I write for the Washington Times on a daily basis, as well as my twice weekly Bold and Blunt podcasts. You sign up, you'll get it all delivered to your email box Monday, Wednesday, and Friday in time for lunch hour. And you will get my special thank you for supporting both my work and the work of the Washington Times. So thank you. Lockdown lies. Lockdown lies. Where are they coming from? Well, they're coming from the Democrat states. Do you know that the face mask mandates that we are facing across the nation are all being pushed by solidly Democrat-run states? These are the Democrat states where there is really no chance of Republicans flipping in the coming elections. So these governors, mad, drunk, on power, don't feel any concern at all about voters booting them out in the next election. And so they're just running roughshod over civil liberties, over, let's put it bluntly here, God-given liberties. And they're forcing kids who have barely a chance of getting seriously ill from the coronavirus or any of its variants, they're forcing kids to wear face masks in school all day long, sometimes outside on the playground, sometimes outside at the bus stop. It's getting ridiculous. And I want to read you this very eye-opening and sad story that a reader sent to me just a few days ago. I've kept it in my email box because it was one of those things that I knew I had to write on. But since I'm doing this podcast today, I want to go ahead and mention this piece as well. The headline from it is this: Palm Beach therapist sees increase in children's speech delays during COVID-19. The author of this piece is an anchor, Mark Kelly. It was written for, WPBF.com, Channel 25. And it opens this way: the Centers for Disease Control and Prevention say putting a face mask on your child is a critical tool in slowing the spread of COVID-19. However, some in the health community are now sounding an alarm. Well, more to truth, some in the health community have been sounding an alarm on this for a very long time. But those who sound an alarm on the perils of face masking children are quickly shut down and stifled by social media, by Anthony Fauci, by the bureaucrats at the CDC, by those on the left in the political world who want to continue to use this coronavirus for political advantage, to exploit even your children to gain political advantage. Back to the piece. Therapists say, I'm citing from this piece now, therapists say they are seeing children with speech delays. And then it goes on to quote Greg Santos. He brings his son Diego to speech therapy twice a week. Greg Santos says this: he would just ramble, baby ramble. Certain words that are key did not flow, so that began to raise a red flag. Santos said his son was born perfectly healthy at the start of the pandemic. He says, we'd go out and walk around the neighborhood and there would be no one there. Everyone just stayed in. It bothers me a lot, he said, of the social isolation and the fact that forced face masking has led to Diego's speech delays. So, a clinical director and speech language pathologist quoted in this piece, her name is Jocelyn Thieck, I think I'm pronouncing that right. She is with the Speech and Learning Institute in North Palm Beach, says that this has been a very challenging year. Her speech therapy clinic in North Palm Beach has seen a huge shift in the ages of its patients as well as the number. Look at this stat, or listen to this stat. Before the pandemic, only 5% of her patients were babies and toddlers. Today, it's more than 20%. Parents have a term for it. They call it COVID delayed. Thieck also said, and this is a quote, we've seen a 364% patient increase in patient referrals of babies and toddlers from pediatricians and parents. Why? They are speech delayed, COVID delayed. And look, Thieck acknowledges that there's no research out there yet that's saying the face masking and the inability of young children to look at their teachers or look at their parents or look to their adults and read emotions and lips and put it all together as a form of communication. Thieck acknowledges that there's no research out there saying that this forced face masking is causing speech and language delays. But that's probably because the research has either been put off by the pinheads at the CDC because they don't want to deal with that, or it's been stifled and squelched, and any scientist or researcher who actually wants to bring forward such research is immediately put in the camp of conspiracy theorist, of anti-science, of attacking Anthony Fauci, who is, as he proclaimed earlier this year or earlier last year, that he is science and that anyone who attacks him is attacking science. So let's put aside the science and the research. Let's just go with common sense, because after all, we are American citizens and we can think for ourselves because we are a country of individualists. And in this country, our nation is great because of the concept of God-given rights. And in order to exert those rights, in order to keep government from stealing those rights, it requires each and every individual citizen to form his or her own opinion based on his or her own research. And medical decisions are among the most sacred of private decisions. So when you're talking face masking children, you're talking parental rights and you're talking individual choice. And here we have a dozen states, 10 states, 14 states, I forget exactly what it is, but we have these Democrat-run states forcing face masking of children in public schools. It's at the point now, it's outright abuse. And my guest today has data that he's going to go over to talk just to that issue. He's going to cite his findings, so that statement will be backed up. He doesn't actually come out and say that it's outright abuse of children. That's my interpretation. But when you see the facts, when you hear the facts about forced face masking and the reasons, the rationale behind the forced face masking just simply do not pan out. When you look at the data, when you look at the truthful numbers, you should be outraged. And guess what? There is a huge backlash that is brewing against the face mask. Again, it's all the Democrat-controlled states that are pushing back against parental authorities. Here's a headline from the Washington Times. Just today, as a matter of fact, New York State fights to preserve mask mandate after courts strike it down. So here we have yet another instance of courts siding with parental authorities, and the Democrat-run stronghold, the Democrat machine in New York, refuses to acquiesce to that, refuses to recognize that not only parents have the right to decide whether or not their children should wear face masks in school, but courts give parents that right. Here's the lead from that piece. New York officials are scrambling to preserve a state mask mandate after a judge struck it down on grounds the state health department needed legislative approval to impose the rule. Remember that? Remember that old branches of government thing? You've got the legislative branch, the executive branch, and the judicial branch of government, and it is the legislative branch's duty and role to make laws. It is the executive's role to uphold those laws. And it is the court's role to strike down laws that aren't in line with the Constitution or underscore laws that are. So here come the courts saying, hey, New York, you can't forever after use an emergency health declaration to clamp liberties on citizens in your state. There comes a time when the legislative branch has to step in and pass laws if you want to do something permanently. And so not just in New York, but across the nation, and especially on Capitol Hill, legislators have been falling in that duty to take the bold stance, if they so support face mask mandates, and pass legislation that puts face masks on the faces of every man, woman, and child in America, or to pass legislation that says, hey, you can't do that. I would love to see legislation on Capitol Hill come forward, putting face masks on every man, woman, and child in America from here forever after, and see what happens. And you know that won't happen because those lawmakers will be booted from office. So this is what's happening. The law-making branch of government is skirting its duties. It's just completely hiding, running, fleeing duties because they don't want to take those strong stances that puts them in the target of those who may criticize their actions. So New York officials scrambling to preserve this state mask mandate, which is unconstitutional, not to mention completely unscientific, which we're about to get into. Completely unscientific in terms of working like it's supposed to work. And now the New York Education Department nonetheless told schools to keep the mandate in place because the state is going to appeal. It's getting out of hand out there in America. It's getting out of hand. The lengths to which the far leftists in politics will go in order to keep their clampdowns in place. And when it comes to the face mask mandates, the science shows they're ridiculous. They don't do what they're supposed to do, what we're told they do, which is supposedly to stop the spread and infection rate of the coronavirus and its variants. And it's the same thing with the vaccine mandates and the vaccines. The long-promised 98% efficacy rate of certain of the vaccines have fallen to the wayside, and yet the vaccine mandates, the booster mandates, vaccine passports in some jurisdictions of America, they're all staying in place. Why? Why? Why are so many Americans willingly giving up their God-given rights to go along with so-called science that has been outed so many times in so many different ways is outright deceptive, outright skewed, or an outright lie? Why? So my guest today, Michael Betrus, he's been a past guest on Bold and Blunt, And he's a great guest because, first off, he's not anti-vaxxer, okay? He has taken the vaccine. And second off, he deals specifically with data. That's his life, data research, that kind of thing. He deals with the numbers. He deals with analysis of numbers, hard and cold facts, which are so few and far between with this whole coronavirus madness. Michael Betrus, he has just released another book, COVID-19, The Science versus the Lockdowns. That book comes after his previous releases of Lockdowns on Trial, which went through 2 or 3 different editions. And again, all science-based, all truthful science-based, all data-based. He's here to discuss and help sift through some of the myths versus realities of modern coronavirus times, discuss the response of our medical bureaucrats, and to point out some very interesting truths that often go unreported. For instance, did you know that obesity is the biggest risk, or one of the biggest risks, of a serious issue with coronavirus? Well, the CDC doesn't harp on that. I don't know why. Maybe it's because they don't want to be accused of discriminating against the obese. Maybe it's not politically correct to point that out. Or maybe there's a more nefarious reason, like the whole big pharma, big government meeting of pharmaceutical companies with politicians and the big money that can be made. And so if you push a vaccine and a booster and another booster and another booster, and you get citizens addicted to the idea that they need shots instead of just allowing natural immunity to take its place, to run its course, maybe there's more money to be found in that. So you want to downplay some of the facts that go along with certain risks, such as obesity. Well, Michael Betrus is here today, and he's going to discuss all of that and more. Michael, thank you for coming back on Bold and Blunt. I really appreciate your time.
Thank you, Cheryl. Back again.
Yes, back again. And it's interesting because I can't remember the first time you were a guest on Bold and Blunt, but it's been over a year, and it just seems like we keep talking about the same thing, the COVID lockdowns, the COVID data, and so forth.
We do. We're making some progress, but it is a little bit of a never-ending story. Hopefully 2022 will wind us down from this.
Yeah, who knew, right? So your book, your second edition of COVID-19 Lockdowns on Trial is out, and I implore people to pick up a copy of this, because what I like about your research is that you cover everything. You cover everything from computer modeling to cruise ships to comparisons of COVID versus the flu. And so you're an expert on the data of the coronavirus. And I first want to start discussions by asking you, how do you view the handling by this current Joe Biden administration when it comes to the coronavirus?
So the administration came into power a year ago, and President Biden's message was really, we're going to stop, we're going to shut down the virus, which is sort of an impractical expectation. And the real focus of the administration clearly has been vaccine mandates, feeling that the vaccine was really the ticket out. And I think a lot of people were really hopeful of that. And early on, the data, if you peeled back and looked at some of the trial data, specifically from Pfizer, you would know that the efficacy really had no chance of being in that 95% range that was marketed.
Right.
However, there is some protective benefit from it. And unfortunately, that's waned, and it hasn't proven to be the ticket out really through, the summer Delta wave or the current variant that we're dealing with now. So you've kind of got I'd say they're putting all their chips in on the vax mandate side, a little bit light on developing and ushering through therapeutics, and probably roadblocking a lot of that. They've been fairly neutral on schools in terms of whether they should be open. I think they've kind of encouraged it, but they've been certainly neutral on the social distancing requirements and mask mandates. I mean, one of the things that's so crazy is when you look at some parts of the country, particularly in the Northeast, you've got kids that are still having lunch outside in this winter weather to achieve the social distancing. And I read last week that in Massachusetts, when they went back to school, they had to open their windows in the wintertime. They had to open their windows 4 inches to maintain some kind of air circulation. So I think what I'd say is the Biden administration put all their chips in on the vax mandates, and the courts have really shut those down. The vaccines have proved to be of certainly some value, but not the bulletproof value that was represented. And they're clearly doubling down on that as much as they can.
So the vaccines, you say clearly they've been proven to be of some value. Define what you mean by some value to people, just so they know where you're coming from.
Well, I think that there is. So one thing that's a little challenging in this is we probably have a good 200 plus million people that have been affected by one of the COVID variants. And so you've got some natural immunity, which is the most durable kind of immunity that seems to be not really up for debate anymore. You've got that. You've got we've got the vaccines that have been out, 3 different kinds of vaccines. And we have had, in the midst of a Delta wave and this Omicron wave, there does seem to be legitimate protection or reduction in some of the elderly classes of people dying and getting hospitalized from COVID. I mean, I'm not an anti-vaxxer, and I've shared this with you. I think last time we talked, I had taken the J&J vaccine myself.
Yep.
And so I think there is some protected benefit. The data seems to support that. It's just not as strong as what was marketed, and it's probably not. There's probably a neutral benefit to those that are healthy and under 30. I'd be very leery about that. That the efficacy of the vaccines could be. Pfizer marketed out that their 5 to 11 vaccine had a 98% efficacy, and I remember doing an interview commenting that doing nothing has a 98% efficacy for a 5 to 11-year-old. So I think that would be very difficult data to prove out. But no, I do think there's some protected benefit from it. I think those that are at risk, that are holding out, would probably still benefit from that. But if you've already recovered from COVID, and even if you've taken a couple shots, I think that then it becomes kind of a moot point.
Well, this is why I like talking with you about the coronavirus, because you deal strictly with data. And you don't really delve too deeply into the politics. You let me do that, and your answers are all rooted in your research and the numbers and the data and what they show. And you just wrote this excellent piece for Brownstone Institute entitled, "Is Masking Kids at School Working?" This is one of the hot debates today. What did the data show you?
Thanks. I actually think that's one of the strongest pieces that's been put out there in the last couple months on this topic.
I do too.
So we did some folks on the Rational Ground team helped me crunch some data, and so we looked at, and it started off with an earnest question. We have 13 states that are requiring every student to be masked right now. They're largely, in fact, they're all Democrat-led states. And we have 11, I'm including your state now.
Virginia, yes.
10, well, Virginia gets included, but for this data purpose, Virginia was actually one of 14 in the mask category. But anyway, we have 10 states that are preventing or largely preventing mask mandates. And so some of those states are like Texas, Florida, Arizona, so large states. The sampling in this is huge. It's cross-sectional across the country in terms of its geography. So it's a very, very good sampling. And the question to be asked is, with this many kids masked in some states and not masked in others, are the masked states realizing a reduction or fewer pediatric hospitalizations from or with COVID? And it seems pretty bulletproof because cases really don't matter. We're testing like crazy right now, so
yes.
Cases really don't matter. The question is, are more kids getting sick in the states that are banning masks and banning mask mandates? Kids can still wear masks, but banning the mandates versus those that aren't. It's a pretty simple question. The data revealed that in the states that are requiring masks, they're averaging, this was just 2 weeks ago, or 10 days ago or so, 4.7 pediatric hospitalizations with COVID per 100,000.
Good
and
Lord.
in the other states, without mask mandates, it was 4. 4 compared to 4.7, which I would argue, considering the 50% inflation or so, meaning people that incidentally are testing positive for COVID but aren't really in for that, you're starting to really whittle this down to be a negligible number. And I think that's an important data point, which is if you're a parent and you're sending your kid to school in Texas or Florida or Tennessee, should you be concerned that your kid is at more risk? The answer is no. The data just doesn't support it.
See, so that just shows this whole mask mania is being driven by fear. And it's fear from what you just spoke of. And I wanted to get into this point. I'm glad you brought it up about testing like crazy and how meaningless case counts are. And we've had this discussion before, Michael, but it doesn't matter. I want to have it again. There are too few people who realize that case counts themselves and positive testing by itself is not really the data we need to focus on.
Well, no, because we're getting, we're getting 1 million cases a day for a period of time in January, and so our hospitalizations are basically the same as a year ago. But there's gross inflation in that. We've even seen this come out of reporting out of New York and California. Pediatric hospitalizations could be up to 70% inflated. What that means is that if you've got 100 kids that are testing positive and hospitalized with COVID, only 30 of those are probably in there for COVID.
Right.
The numbers for adults in general, or for all hospitalizations, we're hovering close to 150,000 right now, which is the all-time high. Probably only half of those are actually in there for COVID. That's not minimizing that for them. It's just providing some context to this. Everybody's getting it. I mentioned this before we went on air, but I went to a wedding a couple weeks ago, and that wedding turned out to be a super spreader event. I got it, and get 20 other people that I know that attended the wedding got it all within a day, and I was laid up with the flu for about a day. Actually, my effects were exactly the same as the side effects from the J&J vaccine. I had one day symptoms, flu-like symptoms, and then it went away.
So is it time to do as the governor of Colorado just suggested, and as the United Kingdom is starting to suggest, just get back to normal, just live your life?
Yeah, Jared Polis, he's the governor in Colorado. I was so impressed with him. I'd originally given Jared Polis a low grade on his handling of the pandemic, but my grading was largely based on the number of kids that had the opportunity for face-to-face learning in school, and Colorado was low in the 2020 to 2021 year. But Polis made a great comment a couple months ago. So as cases started to rise in Colorado, an interviewer said, "Are you going to institute a mask mandate?" And Polis said, "Well, I'm looking at the data out of New Mexico, our neighboring state, and their case curve is exactly like ours. And they've had a mask mandate for months. So why would I do that? It clearly isn't working there." He said, "In my opinion, people are vaxxed. They're either vaccinated or they have the opportunity, and now it's a personal choice. So no, I'm not going to institute any mandates." I thought that was a really reasonable evolution for a governor who had originally instituted some fairly stiff lockdowns and just simply came around by following the science.
So why don't all the governors of all the states follow similarly? What do you think that governors, and we also had this discussion before I hit record for this too, do you think that there are some governors out there that know better, that the science shows that the lockdowns are by and large useless, that they're continuing to put in their states, but they do it anyhow, and they do it anyhow for political reasons or personal agenda or what have you?
Well, it does seem like at least the states that are requiring masks in schools, they're firmly blue states, meaning very little risk of them swinging the other direction. And sadly, this does seem to be political. And so it would be a little bit like Indiana or South Dakota or something, right? I mean, those are firmly red states, and so they're really not going to shift over. So those governors could probably have a wide latitude of policies, and they'd still get reelected. In this case, these governors are at low risk. But the core to your question is the core to really everybody's question, which is these are smart people. Their intellectual capacity is high, to process information, and why they're continuing to simply double down on this I can't understand it. And I don't think that there's parents that realize in many of these states, the whole West Coast states, Illinois, New York, I'm not sure if they realize how unrestricted and normal school life is, for example, or everyday life is. I live in Dallas, or if you live in Oklahoma, and I could go on and on, there's 20 states I could choose from. I don't think that when you're in a restricted state, you realize quite how unrestricted and normal life is elsewhere, with no different consequences.
Right. Well, Alexandria Ocasio-Cortez does, because she left her restrictive state of New York to go vacation in the fairly free state of Florida, and she was called out for it. But it seems to me there are a lot of leftist politicians who take advantage of the freedoms in other areas while mandating that average citizens have to go about with the same lockdowns and restrictions. I know our time is tight, so I just want to go to one final question. You've written COVID-19 lockdown on trial and have done a second edition of it. What were some of the most shocking findings in between your first edition and your second edition that you found?
So they're actually two separate books. I've actually done 3 editions of the Lockdowns on Trial book. The other book that you have is called The Science versus the Lockdowns. And so this book takes a harder look at the science side of it. And so it takes the first 2 chapters are really, what was the lockdown and face mask science before COVID? I called that Science BC. And then what is the science AC after COVID? And I kind of document how we shifted and how we kind of threw out some of the playbooks from the CDC and the WHO that were documented for an influenza pandemic prior to COVID. And then the core, to me, book part of the book, I think the whole thing's entertaining, but the core of it is similar to the article that you read the other day on the face mask thing with schools, is the burden of proof, right? So when you take a look at the most and least restricted states, what is the occupancy of hospitalizations in terms of its percentage of how filled was it, both their ICUs and hospital beds? Because that's what we always talked about, which is we locked down to prevent an overwhelming of hospitals. What you find is that only 2 states had greater than 10 weeks of 20% or more hospital beds occupied by COVID patients.
Wow.
ICU numbers were higher, but what you can't find is any correlation between strict lockdowns and hospital occupancy or ICU occupancy. And I think that's the real cornerstone of this. Because the argument isn't, or debate isn't, is COVID real and is it risky for a lot of people? That's real. The issue to analyze is really, what do we do about it and what worked and what didn't work? And so what I think I proved in a fairly bulletproof format, our analysis was that there just isn't a correlation between better COVID results and tight lockdowns. There's a high correlation between the obesity rankings of states and poor COVID outcomes in terms of hospitalizations and deaths per million, and that's just a tragedy that the CDC hasn't highlighted that.
And real quick, what is your reaction to how the CDC has handled this?
Well, we could do a full day interview on that.
Yeah, I know.
This one. But I think in general they have not done a good job at objectively analyzing the data. So and presenting and their messaging. And so an example, just one quick example, is people that are obese are at higher risk of COVID by a multiple compared to other people. That's just the data. I've rarely heard that out of Dr. Redfield or Dr. Walensky. Rarely. Mm-hmm. I'm not sure if I have heard that as at least a focus of any statement that either one's given. But when you're trying to push vaccine mandates and restrictions on kids that are, let's say 5 to 11s, who a healthy 5 to 11-year-old or even 0 to 17-year-old, a healthy one that's not overweight and doesn't have any other comorbidities, the chances of them having a serious COVID outcome are one in way over 1 million, maybe 1 in 3 million. Whereas the risk that somebody is overweight and has a negative COVID outcome is fairly measurable. And so that's the example of the type of data and messaging that should be coming out of the CDC. Instead, it's more of a one-size-fits-all, everybody get vaccinated. And that's really the only message that's come out of the CDC is everybody get vaxxed and then get boosted. It's like they're almost ready to suggest that people have an IV dripping of mRNA vaccines, to protect themselves, and we're seeing waning efficacy in that.
And then the messaging leads to mass hysteria, mass fear, which leads to more lockdowns and clampdowns. So, Michael Betrus, I want to thank you for your cooler head approach and your fact-based analysis of the truths of what's taking place with the coronavirus. Thank you for being on Bold and Blunt.
Thank you so much.
COVID-19, the science versus the lockdowns. Get your copy. Read it. Read Michael Betrus's work, because if you have the sense that America is headed down the wrong path, which if you look at polls about Joe Biden in the last year, his first year of presidency, it pretty much seems clear that most all of America, even independents and many in the Democrat Party, think we're headed in the wrong direction. You might want to take a look at the coronavirus as one of the core reasons that America is being pulled apart in so many different directions and crumbled from within. And Michael's book gives you, any of his books, give you the data you need to support that common sense viewpoint. I want to thank you for listening and remind you that if you like Bold and Blunt, please, please, please subscribe. Go to WashingtonTimes.com and subscribe there, along with my 3 times a week newsletter. Or go to edify.app/podcasts, the platform for faith-based podcasts. Pick out Bold and Blunt there and check out all the other faith-based podcasts as well, or go anywhere that podcasts are offered. Thank you for listening. Tune in next time, and don't forget, stay blunt, stay bold.